Have you ever felt your genitals are numb, or it is taking more stimulation for you to get to climax? Don't worry, today we're going to be talking about all you need to know about genital numbness. Hello everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, we are going to be talking about genital numbness. But how does genital numbness show itself? Genital numbness can simply show itself as numbness around the perineum, around the skin found there, and around the genitals itself. There might be this burning, needle-like, tingling feeling down there, and there might also be this bluish or purplish discolorations of the genital area. You may want to ask, what causes this? So that is why I'm going to be sharing with you 8 causes of genital numbness. The first one I have to share with you is age. Yes, as one age, we all know the body itself usually age. Same way the bones, the muscles are aging, that is the same way the nerves are also aging. We all know around the genitals, for the women, especially the clitoris, there's a lot of nerves down there that is necessary for stimulation. But as one age, these nerves becomes weak. This could be as a result of reduced blood flow to the nerve. It would also be as a result of damage to the cells over time, and also changes in the tissues around the nerves. In summary, with age, the nerves around the genitals, they become weak. They are no longer active like they were when you were younger. The peripheral nerves that are transferring blood, that are transferring some stimulations all over, they are no longer active the way it used to be. That takes us to the second point, which is hormones. Yes, decrease in hormones such as testosterone and estrogens may be responsible for the genital numbness. Menopause in women is also responsible for genital numbness. For the women, we all know that they produce what is called the estrogen. And when there is decreased estrogens, that is going to lead to changes in the sensitivity of the genitals and also thinning of the vaginal tissue. Definitely, there's going to be reduced wetness, there's going to be reduced secretions to the vaginal area, and that might make that area numb. Then that takes us to the third point, which is strenuous activities. You may want to ask, what kind of strenuous activities are likely going to cause the vaginal numbness or the genital numbness? Strenuous activities such as sitting for too long, especially those who their profession or their jobs allows them or permits them to sit for a very, very long period of time, that might cause the genitals to get numb, because this is applying pressure, it's placing a lot of pressure on the genitals. And also bicycle riding, cycling for too long. When you are cycling, this applies a lot of pressure, this puts a lot of pressure on the genitals. That might result in genital numbness. And with this, which is also where is wearing of tight clothing, tight underwears, might also cause genital numbness. Then that takes us to the fourth one, which is underlying condition or medical problems. The first one, which is very, very common that can lead to genital numbness, is diabetes. Diabetes affects the nerves. Diabetes greatly affects the nerves. So diabetes, multiple sclerosis, spinal cord injury, and some skin conditions can affect the genitals and make them numb. So I think you should take note of that if you are diabetic or something and you're having that vaginal numbness. Then that takes us to the fifth point, which is pelvic floor dysfunction or stress. Pelvic floor dysfunction or stress. We all know the pelvic region. The pelvic region is down there where your genitals are located. So when there is a dysfunction of the pelvic floor, such as some individuals developing high tone pelvic floor dysfunction, it prevents blood flow because the pelvic floor, like, it's tensed up. So it prevents blood flow to the genitals. And when there is no adequate blood flow to the genitals might become numb and stimulation might take longer than expected. Now that takes me to the sixth point, which is medications. What medications are you taking? Because some side effects of these medications might cause genital numbness, such as your antidepressant. If you're on some antidepressant medications, that might result in genital numbness. Then also taking drugs such as selegiline hydrochloride for Parkinson's disease might result in genital numbness, and also finasteride might result in genital numbness. Then that takes me to the seventh point, which is rare. It's like, it's not common, it's not popular, it's rare. So this is not something you should just take into consideration. Is idiosyncratic masturbation care. Idiosyncratic masturbation. So who this really usually affects are people who use masturbation technique over and over again with vigorous, like with a lot of strength, with a lot of tension. So when you are using a particular masturbation technique over and over again, your body system gets used to this technique, and that may make you have this genital numbness in general. So like earlier said, this is rare, it's not that common, so you know. Then the eighth point I have to share with you is trauma. Yes, trauma can result in genital numbness, and one of the trauma that can result in genital numbness is childbirth. Yes, childbirth, and luckily, thank God that as time goes on, it takes few weeks, months to get back. The vaginal numbness might get over itself after the childbirth. Then we also have high impact accidents, road traffic accidents, fall, direct injury to the pelvic area. All these can result in genital numbness. So if you develop numbness in your genital area, you developed back pain, loss of control of your bladder, you may have developed caudal equinal syndrome. If this ever happened, this is a medical emergency and needs to be treated as soon as possible. And also, if you are experiencing genital numbness over time, it is constant, it is advisable you speak with your doctor. This is just a video giving you a general insight. In all, always speak to your doctor for proper advice and guidance. So now let's talk about the treatment for genital numbness. Let me tell you something. In general, the treatment depends on what is actually causing it, what is actually causing that numbness. Once you know the cause, it is easier to provide treatment. So if you know you've been sitting for so long, it is advisable you try standing, you try walking. When you've sat for long, you walk about, exercise to avoid that pressure on the genital area. You can use a standing desk, like instead of sitting, you can use a standing desk, and also use a seat. When cycling, use a seat with a wider base. And people also put on some padded cycling shorts to avoid the pressure from the bicycle into the pelvic, into the genital area, so you can pad yourself properly during cycling. Then if you have diabetes as an individual, try as much as possible to monitor and control the diabetes level. That's going to go a long way to prevent nerve damage on the long run. Then also you can use some lubricants, either hot or cold lubricants, but make sure you check the lubricants on your hands to ensure that, okay, you are not sensitive to it, it's not too hot and it is not too cool. Then the last one I have to share with you is to see a pelvic floor therapist. They can help you with some exercise that will help you bounce back to normal and also increase the muscles, strengthen the muscles down there. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mary saying thank you. Bye, and see you in our next video.